Hi, my name is Faisal Khawaja, and I'm a pharmacist at Marchese Pharmacy in Hamilton, Ontario. The Ontario naloxone program follows the 5 steps to respond to an opioid overdose. We will be using the terms overdose and poisoning interchangeably during this presentation. If you encounter a situation where you suspect an opioid poisoning, you should observe the following steps established by the Ministry of Health. Step 1. Shout their name, if you know it, and shake their shoulders. In other words, try to stimulate the victim to see if they are able to respond. If they are hard to awaken or not waking up at all, you should look for the following additional signs that might indicate an opioid overdose. 1. Their breathing might be shallow or labored or stopped altogether. 2. Their lips or fingernail beds might appear blue or purplish, showing that lack of oxygen. 3. Their skin might feel cold or clammy to the touch. 4. Their pupils, which is the dark part in the middle of the eye, might appear tiny. Tiny or pinpoint pupils are a sign of opioid use. And 5. Their body might be extremely limp. If you notice any one or more of the signs that I just mentioned, you might consider that the victim is experiencing an opioid overdose, and then you will proceed to step 2. So step 2 is to call 911. Now you may be eager to administer naloxone to the victim because you feel that there's an emergency, but you should call 911 first. So make sure you call 911. If you have to leave the victim, you can do so. Ideally, you'll put them in the recovery position, which we'll talk about at the end. If there's someone else present that you can instruct to call 911, that's even better, which allows you to return to the victim that much more quickly. Once you know that help is on its way, you can proceed to step 3, which is to give naloxone. Start by putting on your gloves. Then identify where you want to perform the injection on the victim. The 2 choices you have are the deltoid muscle, which is in the upper arm, the same place you would receive your flu shot or your COVID shot, or the outer thigh, the same place you might administer an EpiPen or an epinephrine injection. The choice is up to you. It doesn't really matter, and you don't need to necessarily remove the victim's clothing in order to perform the injection. Make sure there's no keys or wallet or hard material in their pockets or any embroidered emblem on their sleeve that might impede the needle's progress. Otherwise, the needle should go through clothing just fine. You don't need to remove the victim's clothing in order to administer the injection. Next, take 1 vial of naloxone out of the bag and pop off the top. Then take one of the safety syringes and peel it open. Using the plunger, draw 1 cc of air into the syringe. The upper black ring should line up with the 1 on the syringe. Then, holding the syringe like a dart, carefully uncap the syringe. Then, holding the vial in one hand, take the tip of the needle and carefully insert it into the middle of the rubber port on the top of the vial. Push the needle in all the way, flip it over, and hold the barrel of the syringe in one hand and the plunger of the syringe in your other hand. The needle should just be at the very bottom of the vial neck above the syringe. Push the plunger all the way up so that the air enters the vial. Then pull the plunger down, drawing the liquid back into the syringe. Repeat this process of pushing up the air, pulling out the liquid, pushing up the air, pulling out the liquid, until all of the liquid has emptied out of the vial and is in the barrel of the syringe. Make sure the tip of the needle is as low as it can be in the neck of the vial. This will help to ensure that all of the liquid is drawn out. Don't spend a lot of time taking every last drop out. As long as you've got the majority of it, you're good. Then carefully remove the syringe with a deliberate motion, separating it from the vial. Set the vial aside. Holding the syringe perfectly vertical with the needle tip pointed up, push any air that's in the syringe out until there's only liquid remaining inside. At this point, there might be tiny bubbles stuck at the bottom of the syringe. Then use your finger to flick the syringe so that the tiny bubbles at the bottom rise to the top. Pull down and then push up so that all the bubbles leave the syringe and there's no more air left inside, making sure there's only liquid inside the syringe. Don't spend a lot of time getting out every last bubble. Tiny champagne bubbles are fine. We're going to be injecting into a muscle, and little bubbles like that don't make any difference. To locate the deltoid muscle, place your first finger on the end of your shoulder bone. There should be a little groove there. Place your second finger beside that and your third finger beside that. That represents the upper part of the deltoid muscle. There or just below it is a perfect spot for you to administer the naloxone injection. Alternatively, because the deltoid muscle is in the shape of a triangle, you can use your fingers in a V and press it against the upper arm of the victim. That might help you display where that triangle muscle is. Then just put your needle right into the middle of that. Now we're pretending this is the muscle. Okay, then the needle goes in all the way, all right? And then with the thumb on the plunger, we're going to push that liquid in. And at the very end, we're going to give an extra push with our thumb, which retracts the needle inside of the syringe. Because the needle has retracted into the center of the syringe, now you nor anyone else is going to be exposed to anything that the victim had inside of their body. Massage the naloxone into the arm and then count for 10 seconds. If you choose the thigh muscle instead, locate the top of the muscle just at the groin and the bottom of the muscle just above the kneecap. Divide that muscle into roughly equal thirds. The middle third is where you want to give the injection, just on the slightly outer aspect, the same place you would give an EpiPen. You will observe the victim for 10 seconds and look for signs of recovery. If the victim is not recovering, then you will proceed to step 4, which is to perform rescue breathing and/or chest compressions. Begin by making sure that the victim is on the ground on their back. If you have to maneuver them into this position, please do so very carefully. Then, if you haven't already, put your gloves on. You will open up the victim's mouth, move their tongue out of the way, and using your gloved finger, swish any contents out of their mouth, whether it be food or gum or vomit. Open up the face shield and place it in the victim's mouth, moving their tongue out of the way. Unfold it so that it drapes over their face. Remember, the mouthpiece is for the victim, not for you, the rescuer. So let's say for the moment that that face shield is in there. We have a different one on our mannequin. What we're going to do is we're going to tilt the victim's chin up, we're going to pinch their nostrils, then we're going to give a breath, okay? So when we see their chest rise, we let off and let their chest fall back down. And repeat. So after 3 breaths, we're then going to switch to chest compressions. We're going to take our hand, tuck it under the victim's armpit, drag it straight across. Now we've got the butt of our hand right on the compression spot. We're going to interlock our fingers, bring our weight over the chest, lock our elbows, then we're going to give compressions like this. 1, 2, 3, 4, 6, 7, 8, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. If they're not recovering, we give 3 more breaths and 30 more compressions. We follow this cycle of rescue breaths and compressions for a total of 5 cycles. This should take between 2 and 3 minutes in total. And step 5 is to decide, is your treatment working? After you've given naloxone and CPR, if there's no improvement, stay with the victim. Repeat steps 3 and 4, that is to give naloxone and CPR, and repeat that cycle of naloxone and CPR until help arrives, or you run out of naloxone, in which case you continue with CPR, or the victim begins to recover. If at any point we notice that the victim is starting to recover, which is essentially they're showing signs that they're breathing on their own, then we want to put them into the recovery position. Remember, we will also put them into the recovery position if we have to leave them for any reason, for example, to call for help. In order to put the victim into the recovery position, make sure that they're on their back. Bend one elbow. Bend up the same side knee. Cradle their head in one hand and use your other hand to grab the knee or elbow and use them as a lever to roll the victim onto their side. Their knee should be well draped over their side. Their lower arm should be extended straight up above their head. Their upper hand should be tucked underneath their cheek, and their face should be pointed downward so that if they happen to vomit, they will not choke. This also makes it easier for them to breathe. Then stay with the victim until help arrives.